And as we gather, we are reminded that the town of Bonnyville is situated on Treaty 6 land that is steeped in rich Indigenous history and is the traditional homeland and home to First Nation and Métis people today. We respect the histories, languages, and cultures of First Nation, Métis, and all First People of Canada whose presence continues to enrich our community. Before us, Council, we have an agenda. Are there any additions or deletions, changes to the agenda?
Thank you, Madam Mayor. There are no additions or changes from administration today.
All right, thank you. Looking for a motion then to approve as presented. Councillor Blanchette,
I'll move adoption of the agenda as presented.
all in favor? Carried. Next, we have the meeting minutes from February 24th, 2026. Were there any changes to those meeting minutes as they've been presented? Motion then to approve as presented, please. Councillor Johnson.
I'll make the motion to approve the minutes from February 24th.
All in favor? Carried. Okay, we have a delegation with us this evening, age-friendly Cold Lake. Kathy Oust and Bonnie Folkard, please join us. Welcome.
Thank you.
Yeah. So we'll give you the floor for the presentation. If you don't mind using the microphone when you speak.
In between us.
And then we'll have an opportunity for some questions, comments, conversation after the presentation.
Absolutely.
All right, floor is yours.
All right. Well, first of all, thank you very much for having us. Greatly appreciated. My name is Kathy Ost. I am the Executive Director for Age Friendly Cold Lake. And this is Bonnie Folkard, who is our chairperson. And we're just here to tell you about some exciting news with growing Age Friendly Cold Lake into a regional program and services. So the idea did not come from us, although we're more than happy to comply. But people from different communities have reached out to us saying, we really love your model. We would love to have those services in our community, and we'd love to fall under your umbrella. So this is why we're here. Bonnie, if you want to.
You know what, I'm going to do this and introduce that part.
Mm-hmm.
Okay, perfect. Okay, so just a little bit about Age Friendly, and we gave, these are all in those little booklets that we gave you. So Age Friendly Cold Lake Society was incorporated in 2019 as a nonprofit community-based organization committed to supporting area seniors by providing home support services that allow them to age in place as choice for as long as possible. We have developed essential programs and services delivered by professional staff and committed volunteers, and we will continue to develop innovative solutions to the challenges experienced by seniors and their caregivers as we look to the future needs of an aging population in Cold Lake and surrounding areas. So our mission. So we're quite proud of our mission and our vision statements. So I'm going to share these with you. I'll read it quickly. So our mission is we support underserved seniors in Cold Lake and surrounding area with practical, compassionate services that foster independence, dignity, and connection through every stage of aging. Where the word says underserved seniors, that's a terminology that Healthy Aging Alberta wants us to use, and it's not an insult to anybody who's providing services in the community for seniors, but rather filling in the gaps. You know, what's missing, who's missing what, especially with rural communities. So our vision, we envision a future where underserved seniors are not left behind. Age Friendly Cold Lake is recognized as the trusted resource for seniors and caregivers through reducing barriers, filling service gaps, and improving quality of life through every stage of aging, including end of life.
So I'll walk you through what we have in the package, but just identifying that, as I said earlier, that we really have become a precedent-setting organization in Alberta and actually across Canada. We get comments and contacts all the time. We got one today from Saskatchewan saying, can you provide us with how you developed your model? Can you tell us how you work with your seniors? Can you tell us where you get your funding? Can you help us support in policies and your bylaws and things along those lines? So we're recognized right across the the country. I belong to multiple community of practices with each of the grants that we receive because we are grant funded. Healthy Aging Alberta being one of our long-term and one of our biggest supporters and financial contributors as well too. So, but we are receiving ongoing requests from agencies, municipalities, and community organizations seeking mentorship, guidance, and program models to help them develop their own rural home support services. Our work is being recognized as a leading example of how to build accessible, affordable, and community-driven support for seniors in rural regions. So what do we offer? You'll see in your booklets as well too that there is a card that talks about what the services are that we have in age-friendly Cold Lake, and we also have our NavCare. This is our training platform, so all of our volunteers are trained in palliative care and dementia, so that when they're working with any of our clients, or transporting any of our clients, they have the training. So this is, it used to be Canadian-wide, it's a national, and now it's an international. They've actually expanded into into the British Isles. And this is just one of the projects that we did with them, creating a compassionate community and getting rid of some of the stigma that goes along with the aging process. And then you also have our Community Impact Report from 2025, which really indicates the numbers of services that we're offering to people in the community and the breakdown of what those services really are. So what do we offer for a regional expansion? Age-friendly Cold Lake's established infrastructure, governance, and operational systems. We have experienced staffed and trained volunteers. We have strong community partnerships across health, social services, and nonprofits, a transportation system and scheduling process, access to federal, provincial, and municipal grants for registered charities, and proven excuse me, models already functioning really successfully in Cold Lake. What are the benefits of going regional? Municipalities benefit from cost-effective, non-duplicated service delivery. Municipalities gain a single coordinated service provider instead of a fragmented or duplicated efforts. Seniors receive more equitable access to services regardless of income or location, and seniors across the region maintain independence longer, reducing the strain on the medical system, and clearer pathways for seniors to access services, and reduce caregiver burnout across communities. So who do we work with? Right now, we're working with the Cold Lake Healthcare Center, the Bonnyville Healthcare Center. We are having conversations on how we can better support some of the patients from the hospital, which was one of the initiators for us coming forward with an application or consideration, I should say, for a regional expansion. We're already providing transportation services to the MD of Bonnyville and the town of Bonnyville. In the last few years, we've provided 117 long-distance, non-emergency medical transportation. Because we are funded through Healthy Aging Alberta, we do offer subsidies, so we are not in competition with any for-profit business. Our focus is on low-income, vulnerable, isolated, and again, underserved seniors. So our transportation program, based on income, we use the same financial thresholds as the Alberta Seniors Benefits. So a senior could actually go to the city and back for $50. Maximum would be $300 because Healthy Aging Alberta subsidizes the rest of the trip. So again, just looking at some of the people that we have, you know, we're in touch with home care, social workers, nurse practitioners, the acute care in Cold Lake. We spend a lot of time in the acute care. We do have an end-of-life doula who is on our staff. She's also a social worker and our volunteer coordinator. We multitask at Age-Friendly Cold Lake. We believe that nobody should die alone, and if you don't have family support, and if you don't have anybody in the community for community support, and you're in the palliative care room at end of life, we're there. We go and we make sure that they got somebody to hold their hand or you know, do the mouth care and everything else as they're in their final hours. And yeah, we just feel that that's really important. We also work with Health Canada, Caregiver. A lot of our funding comes from Health Canada via other organizations. Caregivers Alberta, Stepping Stones Crisis Center, the RCMP Cold Lake. I didn't put the RCMP Bonnyville in here because we haven't actually worked on a case with them, but they have called us and they have inquired as to what services we offer so that they were aware if they did have somebody that was maybe in need of some of our services that they would let us know. So FCSSs, we work really right now with the Bonnyville FCSS, where we're developing how we're going to roll out a transportation program. Kind of jumped a little bit there. We were successful in our transportation application to Healthy Aging Alberta, so we will be expanding into further into the MD and more concentrated efforts put into the town of Bonnyville as well too. So more advertising, more volunteer recruitment, more creating awareness of services that are available. All of that will go along with it. Cold Lake Community Church is actually one of our biggest supporters when it comes to not necessarily financial, but the availability of space for free. We run a lot of our programs out of there. Our frozen meal program is run from a volunteer. She's a Red Seal chef. She doesn't get paid for doing our frozen meal program, which is an absolutely amazing frozen meal program. Like they're delicious. Red Seal chef just made them. So
We keep them in our freezer.
yeah, frequently. So what is the ultimate regional impact here? So age-friendly Cold Lake could become the regional backbone organization, ensuring that seniors, especially those who cannot afford private services, lack transportation, face physical or cognitive barriers that prevent them from safely navigating local or out-of-town medical travel, or are simply falling through the cracks, receive consistent and equitable support across all municipalities. By working under one umbrella, municipalities can reduce duplication, strengthen service quality, and ensure that no senior in the region is left behind. So we do have some sponsorship packages that are available. We did, we're in the process of making this into one document, but for now, this is a little bit separate. So this is just sort of a breakdown, this page here, on what each sponsorship offers, what you would be sponsoring or anybody would be sponsoring, and the recognition that they receive for that. So I'll leave that for you to peruse. I don't want to take up all of your time. There is an explanation sheet as well, too, as to what each of these sponsorship levels offers. So I think it's really detailed and it really outlines things really well for you. We've also included our 2026 operating budget for you to have a look at. And then we put in our sustainability 3-year plan, and I think this is what's really important and really relevant for consideration. It talks about what our goals are, what the reasons are. So it talks about the executive summary, our goals, the history and background of age-friendly Cold Lake. It talks about 3 of the services that we're actively starting to pursue in Bonnyville right now. Is there opportunity and availability to foster all of our services with growth? Yes, that can happen as well too. But the phase 1 and the initial intention is to get the transportation. We're running what we call Hope Harbor. It is a day program. The intention behind that program is that it's caregiver respite, but the person who is living with dementia gets quality care. So we're running that 3 times in Cold Lake, and our 4th is at the French Cultural Center across the street. We run that here once a month. We also have a caregiver support group. We run 3 of those, 2 in Cold Lake, and 1 is run out of the Bonnyville Healthcare Center. So that's just, those 2 programs are just new for us in here. I have conversation tomorrow with the social worker at the Bonnyville Healthcare Center to start that referral process, getting it out there and getting it into the hands of the people who can use that support. It's really important to not only look after our folks who may be falling through the cracks, but it's also really important to look after our caregivers because not only do they face burnout and they have one of the hardest jobs in the world, but it also reduces the risk of elder abuse from over burnout and exhaustion and just feeling frustrated with being that permanent full-time caregiver. So very, very important that we look after them as well too. We have our service, we talked about that service offering. So we have our 3-year financial plan, which I think is really important. If you wanted to turn to page 12 we have tried to make this as affordable for municipalities because we know that the onus is on us to really get the grant funding and to make sure that we've got secured, with our sponsorship packages. I'm sure all of you are aware of our Cold Lake Ice Fishing Tournament. That's our major fundraiser for the year. We're very successful at it. Next year, we've been advised that we can actually increase the registrations with the anglers so that we should be able to have hopefully 100, with luck, 200 additional anglers that we'll be able to promote. So not only that, but we bring money into the community from doing that because we advertise all across Alberta. And then we have people in here from Saskatchewan and Manitoba, British Columbia are also participating in that tournament this year. We're still waiting for a couple of invoices, but it appears that we're going to clear about 80,000 as profit from that fishing tournament. So again, we know that we've got financial responsibility. But what we're looking at is you can't sustain a charity or a business or an organization living on just grants. We need to find a way to become sustainable, and we think that this is probably one of the best ways that we can. If you notice down, the 4th item on here is 50,000 right across the board for municipalities. We kept that low, again, as we know that the onus is on us to generate that income. But if every community, and we've already presented to the MD, I'm waiting to hear back from them. It was very, very positive when we left the meeting, and since correspondence since then, we've been invited to, Michael and I went and did a presentation at the Elk Point Seniors Advocacy Committee, and there was definitely interest there on how do we get some of these services, and transportation was their number one issue, their number one problem in Elk Point. So we're looking at how we can do that. And St. Paul has been after me for years. Oh, we'd love to have your agencies here, So I did get an invite to their Chamber of Commerce meeting. I'm double booked for this month, so I am scheduled to go into it for next month. But we're looking at our sponsorship packages and feel confident that a regional approach, as opposed to each community vying for the same dollars, that we could apply for bigger grants, approach bigger businesses, and have more luck as a region than as each individual community in our region competing against each other. And then, yeah, so just raising funds and donations. We do have private donators. We do have, excuse me, an oil and gas company that does match any of their employees' donations to us. So we're looking at growing that as well, too. We do have a social enterprise. It is the client-directed home care invoicing program. We do know, excuse me, we do know that you have Appiday here, and we respect and honor her and her business. We wouldn't be competing because the clients that we would work with are underserved, low income. They can't afford to pay for private services. So, that is, when we first started the client-directed home care, we told Appiday that we would not in any way intrude on her ground or her territory, step on her toes. We won't bring that service into Bonnyville. And again, we only focus on the people who can't afford services. So we don't make money out of that program. It basically covers the income that we receive from Blue Cross, essentially covers the cost of the staff, and we get a few dollars just to cover our admin costs. But it's not a profit-making one for us. It's, again, making sure that seniors have available services and that they can afford, and it doesn't cost them anything to receive those services from us. But again, it's not a moneymaker for us. Yeah, so if there's, we talk here too about our target market. Some of the stats that are here right now are age-friendly Cold Lakes trips, so you can see that, you know, local transportation within Cold Lake, we've done 811 trips in 2025. We have had 246 trips, and those are long-distance trips into the city. If a client needs to have an escort go with them beyond the driver because their cognitive abilities are quite minimal, and you go into the city and those great big tall skyscrapers that are filled with doctor's offices, and somebody with dementia walks in there, they're lost. So not only do we send the driver, obviously, but we send an escort with them to ensure that they get into where they're going safely. If they need us in there to advocate for them, or the family has said, can you please go in with them, and then report back to me, we can do that as well too. And we do that a lot for the caregivers that are working full-time and don't want to use all of their holiday time to you know, take mom or dad into the city. So we do have our frozen meal programs. So since we started that program, we've had 2,387 meals go out of our facility, which I think is really significant. We've had 302 clients for house cleanings. It's not clients, I should have corrected that. It's 302 cleanings that have been done. 295 frozen meal clients, and right now Age Friendly Cold Lake in our community has 164 active clients. So our services are definitely needed. I also did a collaborator analysis so that you can run through that as well. Again, I won't take up your time. You can read this. But it just really talks about who we have as allies and who we have as people that we work with and open to working with us and developing this even further. So we just brought this for you to have a look, and we would love to have Bonnyville on board. As I said, we are starting out with the transportation program because that's the one that is most essential in the feedback that we receive.
Thank you so much for that presentation. I'll open it up to council if you have any questions, comments on the information that was presented. Councillor Kushner?
Thanks, Madam Mayor. Thanks, guys, for the presentation. Very eye-opening. The transfers, the long-distance trips, the transfers, what, if you don't mind me asking, can you just explain a little bit more about, I know you went over a lot of it, but what kind of a vehicle are you using? Is it something like Epiday has, or is it a van?
No, what we do is there's an option. So one of the difficulties that we have is somebody that's in a wheelchair. So we don't have anything that can accommodate that. We can take people if they can support themselves with help getting into the car, but we can't do full lifts into a vehicle because we just don't have a vehicle to support it. So what happens with the long distance transportation is when our link worker goes out into the community, does an assessment and determines that they do need long distance transportation, that then goes into our office, and whenever they have an appointment, they contact us and we arrange for the trip. So volunteers have a choice. They can either take their own vehicle. A lot of the drivers really prefer to rent a car, which we rent out of Enterprise. We have rented it out of Ducharme Motors on a couple of occasions. And obviously then that increases the trip costs a little bit because we're renting a vehicle. So they get a stipend. A trip is $300, so the driver will get $300. They can rent a car, they can take their own. It covers the gas, it covers the parking, it covers a meal for the volunteer on the way home or there, whichever. Yeah, so we try and not always, the doctors aren't very cooperative with us in the city, in the sense that can we maybe change a couple of appointments around and we can bring 2 or 3 at the same time? That doesn't really work very well. The doctors really aren't too compliant with that. But yeah, so that's basically the trip in a nutshell. And like I said earlier, that we will take an escort if the cognitive or physical ability is declined, then we make sure that they're in a safe environment.
So when you work with the hospitals, you talk about transportation for them to the cities as well? Okay.
One of the things that I'm really excited about actually is that Bonnyville FCSS has hired a link worker. So I'm hoping that once the doctors have made a social prescribing referral to her that she then goes into the home and does an intake. So that network of referral is already set up or will be set up through that link worker. We have discussed it. And we're excited about that opportunity, actually. And the same with Shelley from the hospital. She has advised us that she's very excited about this because she has advised us that there are so many seniors that are not getting to the city. And what happens when they're missing those appointments is that they're getting declining health, which often lead to hospitalization. So having them be able to make those trips is actually reducing costs in our healthcare system, in our emergency rooms, in our hospital stays. So it's easier for the doctors to monitor them when they get that care.
Now, one of the things with BRFA is what happens to our ambulances is they make transfers to the city lots, and it's non-life-threatening transfers. And then we've got a whole ambulance gone for 12 hours,
Yep.
right? Have you ever thought of going to AHS and say, hey, listen, rather than putting two people on the road for 12 hours, why couldn't you pay us to do that exact same thing, right?
Mhm.
It might be something that you might want to look at. Maybe you already have.
That's a great idea. Yeah, no, we haven't thought of that one, but that is a great idea. We are looking at referrals, like I say, from the hospital. But that's a great idea. Yeah, we'll follow through with that for sure.
Perfect. Thanks,
For
guys.
sure.
Thank you, Counselor. Any other questions? Counselor Sharoon?
Yes, thank you, Madam Mayor. Thank you for that excellent presentation, very eye-opening. I just have a question on the 2,387. So those are frozen meals, so it's a little bit different program than Meals on Wheels. And do you have Meals on Wheels through Age Friendly in Coal Lake as well?
The FCSS in Cold Lake runs the Meals on Wheels program. Our frozen meal program is, we've got 2 freezers donated from Furniture Galaxy that are full. And people come into the office, they can pick up their meals there, or if they're housebound, they can always go onto our website, take a look at the menu, which you're more than welcome to take a look at. The food is delicious if you ever want me to bring some over. So how that program works, again, subsidized through Healthy Aging Alberta. So we sell to the community as well too. We don't make very much, but we do make a few dollars off of each meal. So a meal to the community, full price is $12 or $13, and I swear you can't get a better meal anywhere for that price. Clients pay $6, so the other rest of it is subsidized through Healthy Aging Alberta.
Thank you very much.
You're very welcome.
Thank you. Any other questions? Counselor Langridge?
Thank you, Madam Mayor, and thank you both for the presentation. Just going through some of the reading materials here. So if I'm reading it correctly, we're hoping to try and expand for the MD of Bonnyville and the town of Bonnyville. And that would be with 3 different service offerings
Right now,
to start, correct? Okay. And so that would be the transportation that we talked about, the Hope Harbor, which would be 1 day a month in Bonnyville, and the Making Connections caregiver. How many days or what does that look like for a schedule?
that caregiver group runs once a month as well too.
Okay.
However, we offer one-on-one as well, and we have had one of the ladies attending the group come to us. If they need to talk to us on the phone, we're available at all times. They just have to give us a call, or we're in Bonnyville enough now having meetings as we start to develop the infrastructure, the volunteer recruitment strategies, and as we start building the programs here. We're here quite a bit now, so if we have to stop and have a conversation with somebody, absolutely, we're going to do that.
Okay, and then on the 3-year financial plan, so you have the municipal contributions listed at 50,000 per year. And then on the bottom, the note, it says the proposed would be 50,000 per year per municipality. So would that be if you had all 3 municipalities?
5.
5? So then that number would turn into 250,000?
Yes, it would, and that would be the monies, that would be the sustainable, so that we can continue the existing programs and then add on to what the other offerings that Age Friendly Cold Lake has. It's unrealistic to think that on our current budget that we can take on 4 other communities and with our staffing and our budget, and sustain that. It wouldn't happen. So this is a way of contribution from municipalities in addition to the work that Age Friendly Cold Lake will do in the securing of additional funding. You'll see in the financial plan that there's quite a task in front of us for getting these budgets up to snuff so that we continue to look after our own without having to rely on grants, and we can expand without having to totally rely on grants as well too for the other communities. So all of the communities would be Cold Lake, the MD of Bonnyville, the town of Bonnyville, Elk Point, and St. Paul. Those are the communities that we're looking at.
Okay.
I shouldn't say we're looking at. Those are the communities that have reached out to us.
Okay, thank you very much.
Very
You're
welcome.
Any other questions?
Those are good questions.
Yeah, thank you.
I like questions.
Thank you. I do have a couple questions as well. First, can you tell me more about, and you kind of touched on it, having to build out the infrastructure and the volunteer base? Because my question was going to be around your like how many volunteers do you have? How many staff do you have? And then what does that look like if you are going to be building out into other communities? You're going to have to bring on more volunteers, as you mentioned. So can you tell me a little bit more about that? What does
Yeah.
that look like?
Yeah, absolutely. So all the communities would fall under the umbrella of Age Friendly Cold Lake. So we may have to increase our staff maybe by 1 or 2 people, but we wouldn't expect each community to have a staff person. The volunteers, it's surprisingly how many like we've got for our NavCare volunteers that go in to do home visits and work with people. We've got 37 of them that are very, very active in our community. So drivers, I think we have more in the summer because a lot of our seniors are drivers are seniors. So we do have more in the summer than we do in the winter. But I think we're up around 8 of drivers. So that's what we would be doing, is just creating an awareness of what it is that Age Friendly, and it was actually presented from Bonnyville to us that the name be Age Friendly Lakeland, which we're in 100% agreement with. But just letting people know in Bonnyville and the MD what services that they can benefit from. And then we create that awareness and we start going out and creating the volunteer base and getting in and going and talking the same way we did it in Cold Lake, going out and talking to the service groups, going out and talking. Shelley has mentioned that she has quite a host of volunteers through the Bonnyville Healthcare Center that we can tap into as well. So it's radio. We do a lot of radio advertisement through Boom, through 99.7. Is that what, 99.7? So it's just getting really creative with how we get our volunteers. People are eager to serve when it comes to senior services. There's a passion that everybody has because the reality is, if we're not there ourselves, we've got family that is, and whether it be parents, grandparents, aunts, uncles, neighbors, everybody is in contact with somebody who is in that aging process. So when they get to the point, God help them, that they have family and they have the connections and they don't fall into the demographic that we really look after. But that's not ever going to go away either. So that's why we're here, and it's why we do what we do.
Oh, that's great. Thank you. And I do have another question. You started off telling us how Cold Lake, your organization, is very innovative, new. Not many other municipalities have an organization like yours. Is it because of the services and the programs that you offer that sets you apart?
Well, yes, it is. And I think that, with all due respect to the FCSSs, I worked for FCSS. I loved my job when I worked for FCSS, but we were restricted by mandates that didn't allow us to go into homes, didn't allow us to transport, it didn't allow us to do a lot of the opportunities that our seniors need. It's the same with healthcare, home care. They're really under strict mandates as to what they can offer as well too. So we fill the cracks. We don't create anything
We created it
I was
based
going
on
to say,
them.
we create it based on the needs that are presented to us. And how we really started, and it's in the executive summary, is that we did receive a significant grant from FCSS Alberta Association when COVID hit because everybody felt in the government that seniors were going to starve. So we had worked for years and years and years finding who are the vulnerable, who are the isolated, who are the people that really need help. They don't go to senior societies, they don't go to social events, they don't go, you don't know who they are. When we offered, excuse me, food at sometimes for nothing, depending on their income and their situation, but sometimes half price of whatever the meal would cost. And then we did partner with FCSS as well too, and we did pay 50% of Meals on Wheels, and we started paying the drivers. It was the first time the drivers had been paid to deliver Meals on Wheels. They continued that, thank goodness. But what happened was when people were coming in to get their meals, they were saying, I got a doctor's appointment and I don't know how I'm going to get there. Okay, that's something we need to address. You know, I just got out of the hospital and I can't clean my house and okay, we're going to address that too. You know, so we built age-friendly Cold Lake on what seniors came into us and said we need, not what we thought they needed. They were telling us what they needed and they couldn't get the help anywhere else. And that's how we built age-friendly Cold Lake.
That's great. Well, thank you so much. That really explains a lot. And kudos to you for being innovative and taking that step and helping our seniors. You know, just as you mentioned, in a rural community, they really need that help and somebody to be there with them. You know, not everybody does have family or friends that, you know, can be there with them.
It's
So
a tough
thank you.
place to be.
Yeah.
Yeah,
And
so
our men's
thank you.
shed, that's great too. We've got our men's shed that for men's mental health and wellness, that's part of the age-friendly umbrella. So they come every Tuesday and Thursday because, as Wayne puts it, when a gentleman, you know, retires, he's lost now all his friends or acquaintance friends, his work buddies. And then now their wife has passed away. So now they don't know how to cook. They don't have any friends. Now they're sitting in a chair, quote unquote, with booze and a clicker. And their lifespan is, what is it, 72, I think, Wayne was saying. So out of depression. And so the men's shed is now growing. And Wayne has now, through just Alberta alone, encouraged 25 men's sheds to open across Alberta. So a chance for men to come together, build something, or just have coffee and, you know, gossip. Women naturally will say, hey, let's go for lunch or let's do this, but that's not what men do. So the men's shed started up, and now we keep seeing that grow as well.
And
That's
on that
amazing.
note, just
Thank
for
you.
your awareness, I know that somebody came to council in regards to a men's shed, and I've also been speaking with someone in the community. I don't think it's the same person. However, regardless, if a men's shed does start here, I've already spoken to our guys. We have excess tools that have been donated. Husbands have died, wives have had to clean out garages. We do have some tools that we would be more than happy to provide to a men's shed if a men's shed does start up here.
Excellent. Thank you.
Yeah.
Yeah, we'll take note of that. Well, thank you very much for your time this evening. I really enjoyed learning more about your organization and see how we might be able to partner going forward.
Great.
Wonderful.
for
Thank you
your
very
time.
much.
Thank you.
Yeah, enjoy the rest of your evening.
Okay, council. Next up, temporary borrowing bylaw.
Thank you, Madam Mayor. The town is required to pass a temporary borrowing bylaw annually for the purpose of financing operating expenditures should the need arise. The maximum borrowing authorized under bylaw number 1612-26 is $2,579,500, which reflects an increase from the amount approved in bylaw number 1594-25. This increase is to adjust the limits on the town credit cards by raising the CIO's credit card limit from $5,000 to $15,000, issuing a new credit card to the operations director with a limit of $5,000, and issuing a new credit card to the building maintenance operator with a limit of $2,500. The proposed increase to the town's credit card limits is required to address rising operational costs and to ensure that each department has access to a dedicated credit card for day-to-day purchases should it be needed. Bylaw number 1594-25 would be repealed with the passage of this new bylaw. The $2,579,500 authorized is well below the $9.2 million that the town is permitted to borrow under the MGA. Currently, we do not anticipate having to borrow for operating. We are requesting that council provide 3 readings to bylaw number 1612-26, the temporary borrowing bylaw.
Thank you. Any questions for administration? Go ahead, Councillor Langridge.
Thank you, Madam Mayor. Through to administration. So do we currently have issues with, like, what is the purpose of raising the limits? I understand the part of where it says the rising operational costs and have a dedicated for day-to-day purchases for each department. But currently, like, what do we mean by each department? Because we have a lot more departments than 2.
Currently, we do have a credit card at FCSS. We have one here at administration. We have like 2 here at administration, I do believe, through the office. Planning and Development has one, but there's not one dedicated at the Public Works shop, which is the reason why one for the operations director, as well as the building maintenance operator. He is at multiple departments throughout his day, and there's times that he goes to a local business and we don't have an account there yet, so he's had to use his own credit card or his own debit card to pay for the purchase. So just for minor purchases for him. And then with regards to the increase to the CIO's limit, it is mostly due to out-of-town conferences. You get to the hotel, all of a sudden your credit card with $5,000, you don't have a lot when you have 7 people with you. So we've had to prepay on that credit card so there's enough money to cover the weekly fee costs that are going to be associated with the conference.
Okay, thank you.
Any other questions? Councillor Schern?
Yes, through to administration. Again, with this new process, would that also maybe cut out on some of the checks that we're having to do, especially for those smaller amounts? And then some of those managers would be more likely to use their credit card than not?
It would cut a little bit out, not a whole lot. I mean, right now we probably do 1 to 2 checks a month for a building maintenance operator. When it comes to the Public Works, they will call down and get our credit card to have, if they had to do something online or anything. It would just be nice if there's somebody not in the office that's able to access that credit card, that they have access to their own.
Okay, thank you.
Thank you. Councillor Kushner?
Thanks, Madam Mayor. So we do this every year. How does this amount compare to previous years?
This is the first time the amount has been increased by just the amount of the credit card limit. It's always been the 2.5 million for a revolving line of credit, which we have not used since, I don't believe, 2007 or 9, one or the other. And then just the little slight increase to the credit cards, which we use monthly for.
Perfect.
From conferences to subscriptions.
Thank you.
You're welcome.
And if I may just add to that as well, one of the challenges are with the credit card being centralized in the town office with Public Works staff. They have to drop what they're doing to come to the office to get the credit card, and then we have to provide it to them. And then challenges is if we're not in the office, then they don't have access to that credit card, and that becomes a personal expenditure that we have to reimburse. So one of the challenges are just to reduce that time that's used to come to the office to ask for that additional support for the credit card. And then the other issue is for tracking. It's a little bit easier for department to department for us to maintain and understand where the dollars are going.
I just have a quick question. Do we have a policy on expenses and what the credit cards can be used for? Is that something that needs to be updated then with these 2 positions?
That would be included with our purchasing policy.
Yeah.
And I do believe it stipulates how much can go on there, who has, the signatures that are required, dual signatures or approvals.
Okay. Okay, council, we are looking for 3 readings on this bylaw. Councillor Kushner?
Thanks, Madam Mayor. I will introduce and give first reading to bylaw number 1612-26, the temporary borrowing bylaw.
All in favor? Carried. Motion for second reading, please. Councillor Langridge.
I'll give you second reading, Madam Mayor.
All in favor? Carried. Motion to move into third and final reading. Councillor Johnson?
To keep with tradition, I'll make the motion to go into third and final reading.
Thank you. All in favor? Carried. And a motion for final reading. Counselor Blanchette,
I will move final reading of the same bylaw.
you all in favor? And that's carried. All right, that bylaw has passed. Next, amending land use bylaw. Who wants to take that one?
Thank you, Madam Mayor. Administration has received an application to rezone a portion of 3702 50th Avenue as shown in Schedule A of the amending bylaw. The applicant would like to rezone this area from its current of urban reserve to R3 medium density residential district for the purpose of creating 4 medium density lots in order to facilitate construction of townhome residential units. Any concerns regarding parking and access to these proposed homes would be reviewed and addressed at the development permit stage, as well as at the Municipal Planning Commission stage of the process. Housing is becoming difficult to find in certain price points and as well as in rentals. Administration is recommending the council approve first reading of bylaw 1613-26 and direct administration to advertise and set a public hearing date for the first regular council meeting in April. That is a minor correction from what you would see in the RFD as a result of a change that's coming a little later in the agenda.
Okay, thank you. Any questions for administration on this request? Counselor Schroen.
Yeah, just a question through to administration. Is that 3702 50th Avenue address correct? Because when you look at the map down below, you have like 38A Street. So I don't know where that all fits into place there. Because when I took a drive to that the address, it came up with the location between the new 7-Eleven and that subdivision there. But am I out on that?
Madam Mayor, through you to council, there's a large block where the block is listed at 3702 50th versus the portion that they would like to rezone is specific to the area just off of the cul-de-sac on the north end of 38A Street.
Okay, thank you.
Thank you. Any other questions? Counselor Kushner?
Thanks, Madam Mayor. So you're looking for medium density, easy for me to say, through to administration. What does that exactly mean?
The medium density, the R3 zoning would be required for the plan that the developer has would be to turn this area into 4 larger lot sizes, and each of those lots would hold townhome style accommodations. So it's multi-residential.
So when a while back we did something similar, and looking at this, I see there's a lane down the south side, and then there's a lane, but it ends on the north side, and then there's a lane on the east side. Are those lanes going to be made when before they make this, or is it part of the change, or what does that look like?
That would ultimately be part of the development permit where we would enforce that those lanes would be put into place. And the difference between this rezoning application and the previous rezoning application is the previous one was rezoning from R1 to R3. This is going from urban reserve to R3. So there was no predisposition on this land. But yes, the lanes would be included, and we have had much contact with the developer. They understand what our requirements are going to be for when it comes to off-street parking, so as to accommodate the multiple residences.
So urban reserve, they left that as urban reserve just so that it was cheaper tax-wise. Is that the understanding?
I would be able to give you the mindset of the developer when they created that area structure plan. One could make that conjecture that that is why. I would suggest that they probably left it as urban reserve so that there was some flexibility to be able to develop what the market is looking for at the time.
So when you say urban reserve, I'm not part of this world. What does that exactly mean? Like, it's just land that's reserved and then you make a plan after that?
It's placeholder land, so it has essentially no current designation, but it's a placeholder in that there is a property holder and it is zoned as basically nothing at the moment. It's blank land that can be developed as seen fit by the developer, assuming that they meet the requirements of an area structure plan that may or may not be in place, as well as the requirements that we would put on them at the development permit phase.
Thank you.
Okay, thank you. Any other questions?
Sorry, through Madam Mayor to Council, I'd also add that part of the urban reserve designation also allows that the municipality, if it identifies areas that needs to have easements, it's easier for the municipality to actually apply for those easements to be a part of that. And then the discussion would be with the subdivision developer itself, there would be negotiations on how those easements would be in place. So as the development fills in, the municipality also has the ability to have flexibility in those discussions and negotiations with the developer directly. So urban reserve does allow a little bit, like was stated before, a bit more flexibility in the options of what are available. It also depends on if the area structure plan in this case would be, different from what's being proposed, allowing them to then go into a subdivision rezoning application proponent of it with a little bit less red tape, I guess is the easiest way to put it, as well as part of the surveying portions of development. They can then cut out pieces as they need a certain sizes. So with surveying and land titles and all the other pieces for the subdivision cutouts, it just allows, like it was stated before, a lot more flexibility for the developer.
Thank you. Councillor Langridge?
Thank you, Madam Mayor. Through to administration, if we were to proceed and rezone this to R3, within the land use bylaw, would we have any constraints later on when we look at the development permit to holding them to task on things like parking and that, if we were to give it because if we zone it R3, does that put us susceptible to them being able to go around anything because of the rezoning?
Madam Mayor, through you to council, no, the land use bylaw, ultimately the intent and purpose of the land use bylaw is to be able to put those kind of architectural and infrastructure controls in place so that at the development permit stage, even prior, generally you have a conversation with the developer ahead of time and they kind of float their ideas past us before we ever get to this. And then we're able to let them know what requirements we're going to have on them. Not only from the perspective of, yes, those lanes are going to need to be in place, what the off-street parking is going to look like, as well as gives us the ability to ensure that the services that would go to those lots are adequate for that particular type of housing that they're bringing in, rather than if it's already been designated as, say, R1, R2, then the servicing is at one particular requirement level. So there's an level of expectation there versus, if you're putting in multi-residential buildings, then the servicing level is going to be at a little higher standard.
Okay, thank you very much.
Any other questions? I mean, I like the plan. I think my concerns are the same with my other councillors, is just the flow of traffic. It's becoming a very high density area. We've got the apartment buildings, family reunification buildings. So I think for me, that would be an important condition that they meet those before this type of housing gets built. But I think this type of housing also, it matches kind of what's already in that area. So I'm not necessarily opposed to the type of housing. It's just the the movement of residents in that area, so the traffic flow, but that's just my comment. All right, we're looking for a decision, council, if there's no other questions, first reading and to direct administration to advertise. Councillor Blanchett?
Sorry, Madam Mayor. One question just dawned on me. So when I'm reading the background in this RFD, it indicates construction of townhome residential units. Is that what we consider in our land use bylaw row housing?
Correct. That would be what, they tend to be interchangeable terms, but that's what a lot of people would deem as row housing.
Okay, so thank you. So when I'm just looking at the R3 residential district, and row housing's indicated as discretionary use anyhow. So regardless, if they made an application for row housing, it would come back to MPC anyways.
Correct. So there's going to be, Madam Mayor, through you to council, there will be 2 checkpoints on any type of development that's going to go in here after the rezoning. The first would be at the development permit stage, where we would catch issues and bring them up. And then, yes, there would ultimately be an MPC application that would come through as a result of that development permit. And that would bring it back to council for discussion.
Thank you.
Thank you. Any other questions? All right, so we are looking for a decision, either way. Councillor Johnson.
I will provide first reading of bylaw 1613-26 and direct administration to advertise and set a public hearing for the first regular meeting that we're going to have in April.
Any questions on the motion? All in favor? And that's carried. Thank you. All right, next, RMA District 5 Annual Golf Tournament.
Thank you, Madam Mayor. Lac-La-Biche County, on behalf of rural municipalities of Alberta, District 5 has issued an invitation to elected officials to participate in the 2026 RMA District 5 Annual Golf Tournament. This event is scheduled for Thursday, August 6, 2026 at Lac-La-Biche Golf Course. Save the date notice has been circulated with final event details, including registration fees and other logistics. Still being finalized, Lac-La-Biche County has recently completed infrastructure improvements at the golf course and is also seeking sponsorship connections through participating municipalities. Further information will be provided directly to municipalities as it becomes available. The current recommendation is that council approve attendance for any interested council members at the RMA District 5 Golf Tournament on August 6, 2026, with administration to proceed with registration once event details are finalized.
Thank you. Any questions, comments? It's important to attend, especially since it's, fairly close in our neighboring municipality of Lac-La-Biche. I think for us to have some exposure and attend would be a neighborly thing to do. Councillor Kushner?
Thanks, Madam Mayor. I agree with you. I just have trouble making a motion when we don't know what the costs are going to be. That's where I couldn't support this without knowing the costs, would be my opinion. So what maybe we could do is bring this back when we know the costs, and maybe, keep it open as save the date, like you say, but I can't see myself voting for this the way it's written, that we don't have any costs here.
Yeah, I agree. Yeah, Councillor Lankridge, sorry.
No, I was just going to say I would agree with Councillor Kushner. It's you don't see too many save the dates for golf tournaments. It's more of a wedding style thing or something like that. But there's no information here whatsoever. So I didn't know what we were approving at this point in time. So I would agree with Councillor Kushner.
Yeah, I think I would agree, but I think getting consensus from council that this is something that we should attend, and then we can save the date in our calendars, and as we get information as far as the cost, is it per player, is it a team, then we can bring that forward once we get it to council. That work?
Thank you, Madam Mayor. What I would suggest then is, once we receive the information from this, we'll maybe tentatively save the date, so to speak, just so we can get the information. And once we have it, we can circulate it via email to council, and then from there we can bring it to a future council meeting, once that information is made available.
Correct. Okay. All right. So we don't need a motion though.
I think just direction's fine to save the date.
Yep. Okay. Excellent. Thanks. Are we good, council? Yeah. Excellent. All right. Thank you. Next, rescheduling of the April 14th regular council meeting.
Thank you, Madam Mayor. Due to the upcoming Economic Developers of Alberta experience and 2026 Leader Summit and conferences and scheduled to take place of the week of April 13th to 15th, both the CAO and the mayor are registered to attend this event on behalf of the town, as well as valuable opportunities for economic development, learning, and strategic networking and advancement in municipal initiatives. I also believe that there's a few councillors that will be out of town on different other requirements for council as well. So the challenge would be if we do host a meeting on the April 14th date, we would be looking at a loss of quorum for council. And the suggestion right now would be, and the recommendation is that council cancel the April 14th, 2026 regular meeting and reschedule to April 7th, 2026 due to the CEO and mayor's attendance at the economic developers, as well as the other councillors on unavailability during the Leaders Summer Conference.
Okay. Thank you. Any questions? All right. Looking for a motion then. Councillor Schrin.
Madam Mayor, I'll give you that motion that we cancel the April 14th, 2026 regular council meeting and reschedule to April 7th due to a not being able to have a quorum.
All right. Thank you. All in favor? Carried. Okay, next, CPO program policy and SOP manual.
Thank you, Madam Mayor. The Solicitor General's office requires that municipal CPO programs have policy direction that matches their specifications. Further, Solgen also updates these specifications regularly in their monthly bulletin, and this results in program adjustments multiple times throughout the year. In order to minimize the number of required policy adjustments on an ongoing basis, a single program policy was created that empowered the use of a procedure manual to reflect the Solgen requirements of the program. As Solgen requirements change, the procedure manual will be updated rather than the policy to minimize the administrative impact on council meetings. Further, the procedure manual becomes the source of the most current program requirements and the go-to in the day-to-day operations for both new and existing CPOs. Administration is recommending that council approves the CPO program policy with the attached procedure manual.
Okay, thank you. Any questions on these changes? Okay, we're looking for a decision, please. Councillor Blanchette.
Thank you, Madam Mayor. I will move that council approves the CPO program policy with the attached procedure manual.
Thank you. All in favor? Carried. Council, at this time, I'd like just to take a small, short pause in our regular programming to highlight an internal promotion. We'd like to recognize that Wanda has completed her Dalhousie Leadership Program, and she is eligible to be promoted to senior CPO position. And with that, CAO Winfley and I will be presenting a couple of new epaulets. Yes.
Oh. You guys stay there though.
Sorry, thank you, Dan. I know. All right, let's move on to committee reports, and we'll start with Councillor Johnson, please.
Thank you, Madam Mayor. February 26th, we had an FCSS board meeting. February 27th, I attended the Economic Growth Forum in Lac La Biche at Portage College. And then later that evening, I was at the Victor Ringuette Sportsman Dinner. March the 2nd, community policing. And last night, I had an Ohana Center meeting, and that's all for me.
I got to go back to February 12th. I was here for a little while with Emerging Trends with Brownlee Law. Also on the 12th, did some Alberta Winter Games opening ceremony run through in Cold Lake. And then on the 13th, I had the pleasure of being an ambassador for the Alberta Winter Games. And then later that night, opening ceremonies. And I would like to thank all the volunteers. Neil, you did a great job. Everything came off wonderful. Very excited to see what you guys pulled off. It was fantastic. So good job at everybody, all the volunteers. Michael, you're here too. Good job. It was wonderful. I was really happy to see it. February 17th, we did a strategic planning, and also on the 17th, economic development meeting, just a quick one, and that's all I had.
Okay, so for myself, February 25th, we did the Health Gala video for the upcoming anticipated Bonnyville Health Foundation Gala. On the 27th, also attended the first economic forum in Lac La Biche. It was quite an interesting evening, and I really enjoyed the concept and learning that Lac La Biche has deemed themselves the Lac La Biche advantage, the natural advantage in Lac La Biche. So, but I thought it was a really great event, and I look forward to future events. On the 3rd, through the Alberta Bilingual Municipalities Association, we had a meeting with Minister Furr. We approached her with a funding request, and we are looking to work with the Government of Alberta to create a formal avenue for municipalities to be designated as bilingual. So more to come on that. And then on the 9th, I had the Health Professionals Recruitment and Retention Committee meeting. That's it for me.
Thank you, Madam Mayor. On the 25th of February, we did the Health Foundation Gala video recording. On the 4th, I was at the C2s to sign checks. On the 6th of March, we are still going through some wrap-up meetings for the Alberta Winter Games. That'll probably be going on for the next little bit here still as we get all the loose ends tucked away. And then yesterday, a medical professional recruitment meeting and a library meeting in the evening. That is all from moi.
Thank you. On the 25th of March, I attended a LICA meeting followed by the video shoot for the hospital gala that afternoon. On the 27th, I attended on behalf of Alberta Munis, a recap of the 2026 provincial budget, and that evening attended the Victor Ringuette Sportsman Memorial Dinner. March 3rd, I traveled to Two Hills representing Alberta Munis for their grand opening of their solar generation system, ice plant, and EV charging station. This was a collaboration between the town and county of Two Hills, the Ag Society, and provincial federal governments, along with AB Munis, who was instrumental in obtaining some grants. They're estimating that they're going to save $30,000 to $50,000 a year in energy savings. We got to go where the ice plant was. It's a building half the size of this, and all the new equipment is there. You can talk in there. It runs so quiet. So they hadn't had the ice surface was ready. The curling rink wasn't quite. The floor wasn't cool enough for them to do the water. So it was interesting. And from the time they applied for the grant to the time we did the grand opening was less than 2 years. So fantastic for a small community of 1,500. Today I had a chamber meeting. Just some friendly reminders. Our AGM is on March 18th, at the Bonnyville Neighborhood Inn. At 11:30 is registration, lunch at 12:30, and meeting to follow after. April 22nd, they're having a job fair at C2 here in Bonnyville from 11 till 6. The cost is $75 for a booth for members and $100 for non-members. And that's all I got.
Thank you. February 25th, I also participated in the filming for the council content for the hospital gala. February 26th, FCSS board meeting. February 27th, my first Northern Lights Library System board meeting, followed by the Alberta Municipalities virtual briefing on the 2026 provincial budget, and then the Victor and Get Sportsman Dinner that evening. March 6th, I attended my first meeting of the Alberta Municipalities Health and Social Wellbeing Committee in Edmonton. The key topics of discussion that day was continued advocacy for the FCSS program, affordable housing, and we had a lengthy discussion about the distinctions between affordable housing and low-income housing and some strategies to address NIMBYism related to both in communities. And then the final topic was access to healthcare across the province, particularly in rural areas, and strategies for recruitment of healthcare professionals. Yesterday evening, we had, as Councillor Langridge said, we had a library board meeting, and I'm happy to report that I also spent time over the past few days establishing the new Friends of the Bonnyville Library Society. So all of the documents related to that have been submitted to corporate registries. And once that is approved, we will be able to begin fundraising and pursue grant opportunities in support of the library. And then finally, my role as the president of the FCSS Association of Alberta, I had the opportunity to participate in the Budget 2026 virtual lockup presentation, and did a media interview regarding Budget 2026, had a couple of committee meetings, and then touch point meetings with the executive director. And that is all for me.
Okay, thank you. Under correspondence, we have the invitation for the St. John's United Church Bonnyville Country Hoedown, which I believe was sent to council already. And then we've got a couple proclamations. The International Day of Prescribing, 26th of March, 2026. Whereas social prescribing is an innovative and holistic approach to healthcare, bridging the gap between non-medical healthcare needs and social care, connecting older adults to community-based programs to enhance their quality of life. The Bonnyville Link Up 55 Plus program will work together with health and other organizations in Bonnyville to bridge the gap, connecting older adults 55 plus to non-medical supports that improve well-being and support aging in place. Now, therefore, the town of Bonnyville hereby proclaim Thursday, March 26th as International Day of Social Prescribing in the town of Bonnyville. National Social Work Month, March 2026. Whereas March is recognized across Canada as National Social Work Month, a time to recognize and celebrate the invaluable contributions of social workers who support the well-being of individuals, families, and communities. And social workers play a vital role in communities such as the town of Bonnyville, supporting residents through times of change, hardship, and growth, while advocating for equity, inclusion, and community well-being. The 2026 theme, Reflecting on Our Past, Reimagining Our Future, calls on communities to work together with open communication, mutual respect, and shared commitment to justice in order to support current and future generations of social workers. Now, the town of Bonnyville hereby proclaim March 2026 as National Social Work Month in the town of Bonnyville. Okay, we also have our community organization funding up to date to February 27th. And questions for administration? Councillor Blanchette.
Thank you, Madam Mayor. I just have one quick question regarding the United Church event. Did we already budget for that event to attend it?
I am unsure. I will have to check and get back to you.
Okay, thank you.
Any other questions for administration? Seeing none, we have a few items in camera. I'll get a motion to move into camera, please.
I'll make that motion.
All in favor?